So, to Dr. Nicole, can you just briefly describe what are healthcare disparities and why do they exist?
So I guess the healthcare disparities, in probably one of the simplest definitions, is a difference in the incidence, the prevalence, and the outcomes of diseases and their complications. And, like I said, we've known about these forever. And so, even those of you not in medicine, and certainly Dr. Sherry and I can tell you that when I was in medical school some years ago, we would have lecture after lecture about, Black people have higher rates of diabetes and higher rates of high blood pressure, and they're more likely to die from cancer, and they're more likely to die from heart attacks. And so, we know that those statistics are in fact true. And that's really the essence of health disparities, is that if you look at different populations, and then tonight we're primarily going to be focused on race and ethnicity, but sometimes there may be disparities in gender, maybe, between men and women. And there may be disparities based on, geographic locations, but it's just those differences that exist. And the key is that they don't exist because of any biological factor. It's not because of genetics. If you're Black, there's no gene in your gene pool that says that you're more at risk for a particular disease, or that you're more likely to die or have complications from that disease. And so why they exist is multifactorial. We're going to talk more about that throughout the evening, but certainly there's a lot of different factors, specifically if we talk about the disparities that we see between Black people and non-Black people. And a lot of that has to do with access to care, even in people that have health insurance, but certainly Black people are more likely to be uninsured. And so there are less opportunities to get that preventative care, Dr. Stephen, that you were talking about. Black people, for many reasons, if we talk about what we call the social determinants of health, so things like, where you live, do you have access to, safe and affordable housing? Do you have access to green spaces where you can exercise, freely? Do you live in areas that have fresh air? Do you have access to fresh fruits and vegetables? Your income, there's income disparities. So all of these things really come into play. The education system, all of this is rooted in racism, just like disclaimer, but we're going to go more into racism in a few minutes. But it's all rooted in racism. And so when you have individuals or a group like us, Blacks, African Americans, and they have been historically subjected to, racism and to really differences in the opportunity to live and to thrive, then it shouldn't be surprising to us that we have different health outcomes. So just as an example, if we take diabetes as an example, or even obesity, I think there's like 86% of Black women are overweight or obese compared to like 19% of non-Black women. And so when I was in school, they basically made us feel like, well, that's just because Black women don't eat right and you guys don't exercise, so just do better, And it's like, no, like when you really start to delve into it, there's so many factors, many of which I mentioned, but if you live in an area where your closest grocery store is a corner store, and where you don't have access to fresh fruits and vegetables, or maybe you have access to fresh fruits and vegetables, but all of us on this panel know that they cost a lot more, right, than if you go get something in a can. And don't even get me started on organic versus non-organic. So, when we as physicians just tell our patients, like, eat healthy, without having an understanding of what that entails and whether our patients are really able to do that, do they have the money to afford fresh fruits and vegetables? Do they live in an area where they even have access to that? And so I think what has frustrated me the most about health disparities is that historically we have blamed the patient, or we've planted this seed that, Black people are somehow genetically inferior. And so when we do that, it makes the healthcare industry, the professionals, the administrators, it basically gives them a pass to just sit back and say, oh, well, there's nothing we can do about this because Black people just have bad genes. But now, thankfully, with more research, we know that there are lots of reasons why, and that there are even barriers within the healthcare system itself that really perpetuate some of these disparities. So I hope I answered your question. I feel like I got off track a little bit.